Hi, this is Dr. Prabhat Tiwari, maxillofacial surgeon at FMS Dental Hospital, Hyderabad. Jaw corrective surgeries or orthognathic surgeries are basically changes in position of the upper and the lower jaw in relation to each other, or sometimes in relation to the skull itself. This is done to correct any malalignment that may be pre-existing. When there is only a minor or major tooth alignment problem, we have various options available with braces and aligners. But when there is an associated alignment issue for the jaws themselves, braces may not be enough. These are the cases which require orthognathic surgery. Now, who is it for? Have you seen people with a very small chin, lower jaw, backwardly placed, excessively proclined upper teeth, and sometimes a huge gummy smile, a severe exposure of gums when they are smiling? All of them could benefit from orthognathic surgeries. So when do we advise these orthognathic surgeries? You can have bite problems affecting only the teeth, or there can be severe bite issues originating from incorrect positioning of the jaws themselves. In such severe cases, chewing the food might not just be difficult but painful sometimes. It can also affect the way you speak and your ability to swallow the food. In these cases, braces alone may not be enough and you may require orthognathic surgery. But with orthognathic surgery, it doesn't just correct your bite. It also is going to affect overall look of your face. Your facial profile changes and all will be significant. That is why it can be used many times for facial asymmetry correction or other facial imbalances. It can also in some cases provide a better breathing experience. The movement of jaws allows your nose and airway to open up, and hence we can use it for relief in patients suffering from sleep apnea. So in short, orthognathic surgery can help you improve functional disturbances of bite, thereby helping you chew better and reducing overall wear on your teeth. It can also help you speak better and swallow better by reducing malalignments of the jaws. It can even help you breathe better in some situations. Now, how does orthognathic surgery work? It will be done by an oral and maxillofacial surgeon, but it has to be a team effort in consultation with an orthodontist. You will have to go through braces or aligners before the surgery to put the teeth in their required position, and for a few months afterwards. So what surgeries are usually performed? Most of these surgeries will be done from incisions inside the mouth, leaving no scars on the face. The exact surgery depends on the clinical situation, whether you have a small backwardly placed upper jaw or a big forwardly placed lower jaw. In these cases, specifics will decide whether the jaw has to be brought forward, which is known as maxillary advancement, or the lower jaw has to be advanced or pushed back. Sometimes the jaw looks small, but the teeth are in correct position. In those cases, we only move the chin part of your lower jaw, which is also known as genioplasty. Once these jaws are moved into their desired positions, they are fixed in place with titanium mini plates and screws, which are very small hardware. Now, many of you have doubts about whether I will have those metallic things inside my jaw forever. They are very well compatible with all of your body tissues, and so usually we leave them there because they are inert, they do not mess around with your function and do not cause problems with any medical test that you may require in the future. So after surgery, what does the recovery look like? Many of you are worried that after orthognathic surgery, you won't be able to talk, mouth will be wired shut. 99% of the cases, that is not true. There might be some elastic bands to guide your jaws into the new positions that we have created, but you will still be able to talk and swallow food. As with any major surgeries, there are some complications like pain, swelling, etc. You will have swelling on your face for a couple of weeks after the surgery, but you have to remember orthognathic surgery will create a significant change in your facial profile most of the times. So you have to get used to your new facial structure. Also, you have to learn to communicate in a different way in certain situations. What about safety? This is as safe as any other major surgical procedure when performed by an experienced and qualified oral and maxillofacial surgeon. You will be expected to maintain excellent oral hygiene, stay on soft diet, and rest at home. Avoid any strenuous exercises for a few weeks after the surgery.